Good afternoon. My name is Dr. Dale Bratzler, D-A-L-E, B-R-A-T-Z-L-E-R. I'm the University Chief COVID Officer here at Oklahoma University. I'm going to give you just a brief background and summary of the events of the week with respect to COVID-19, talk about the new cases, and I will spend some time talking just a little bit about hospitalizations and other concerns that we have in the state right now. Most of you are probably aware, just about an hour ago, the State Health Department updated the numbers for Oklahoma. We're just over 19,000 confirmed cases in Oklahoma. We had 596 new cases today. And if you're not aware, for this past week, we had an additional 4,000 new cases that occurred. So right now, if you look at the 7-day rolling average, we are seeing on average 575 new cases each day in the state of Oklahoma. The other thing that shows up in the data is that the number of tests that are being run where the result of the test is positive for COVID-19 has gone up dramatically. At our lowest level on the week of May 25th, only 1.8% of all tests were positive. This past week, so far for this week's data, 9.7% of every specimen tested was positive for COVID-19. So we've seen this dramatic increase in the percentage of tests that are coming back positive. There was an increase in the number of tests done this week, and I think many of you are aware that there is increased demand to get tests done. We're seeing that across many states where there are outbreaks of the virus, where it's getting more difficult to get appointments to get testing done just because of the sheer number of people that are requesting them now. The other concern I have right now is the number of people in the hospital. So right now, as of yesterday, there were 487 people that were hospitalized with COVID-19. Of those, 361, which is a very high number, had confirmed COVID-19. These are not people who are persons under investigation. These are people who the test is positive that are in the hospital. And of that group, that 361 patients with a confirmed test, more than half of them were hospitalized in an intensive care unit. So we have great concern about that group of patients because they're obviously very, very ill. You know, as I was telling one viewer, you don't get into the hospital today with mild COVID-19. If you're in the hospital, you're usually very sick, and more than half of the patients in Oklahoma that are in the hospital with a confirmed test are in the intensive care unit. The last thing I wanted to highlight in the data is that we've been watching CDC data and Oklahoma State Health Department data, and everybody talks about the real peak in the new number of cases that we're seeing in Oklahoma right now. And it's certainly in a younger age group, in that 18 to 35-year-old age group. But this past week, we saw a substantial increase in the number of new cases that are happening in people that are 65 years of age and older. So it started around the last week of June, and there's been a slow but steady increase in the number of patients who are 65 and older who are now being tested that are testing positive for COVID-19, which is exactly what we were concerned would happen. If you have a lot of young people who are testing positive that are mobile and social, that eventually they will interact with older people, and the older people now are starting to show up as new cases. So I won't be surprised if we continue to see growth in the number of patients that end up in a hospital because an older population is also getting infected at this time in Oklahoma.
I know we say this a lot, it's too early to have enough research on a lot of these things to know these things, but I did see something recently that showed viruses. There's so many viruses that people get that end up having symptoms or problems for the rest of their lives. And so I assume or there's a fear of that with COVID-19 as well, that, I mean, like the herpes virus, the HIV virus, what are some others? But
yeah, so the question is, you know, there are some viral illnesses that we know that once you get them, you may have recurring symptoms, and others for the rest of your life. That's typically not been the case with most coronaviruses, the common cold virus as an example, but I don't think we know in the long term whether there'll be any potential permanent consequences of COVID-19 for people who have survived it and may have side effects down the road. We just don't know at this point.
Okay, we've got lots of questions today. Cassie at the Frontier is asking if you can talk about whether there's been any kind of change in Oklahoma's death rate and with the increase of cases that we've seen.
Yeah, so has there been any increase in the death rate? So the good news is that in Oklahoma in general the death rate is quite low, and in fact because there are so many people being tested and often the people that are testing positive at this time are younger people, their mortality rate tends to be lower. So currently, if you look at all of the confirmed cases in Oklahoma, the reported mortality rate is about 2.2%. Remember, it was 6% when we first started tracking this in early April. That said, we are seeing some continued growth in new deaths in the state. And again, that's part of the reason I highlight the number of people that are in the intensive care unit in Oklahoma, with more than half of the people with a confirmed diagnosis who are in the hospital being in the intensive care unit. As we know, those patients have a higher risk of complications and actual deaths when they're in the hospital. So I do have that concern that we're likely going to see more deaths over time, just because we have a bigger population of people hospitalized and a good percentage of those people are in an intensive care unit.
When you're looking at hospitalized patients that test positive for COVID, is it always that they've come in for COVID, or is that including people that maybe, because I think I know our hospital as well as others are probably, before they'll do a procedure that maybe was already scheduled, they test for them. Are we finding that a lot of positives there as well?
Well, absolutely. So we test all patients that get hospitalized now, and we also test all patients who are having any elective procedure before we'll do it. So we're identifying a group of patients who may not have symptoms, don't even know they're infected before they have procedures. I don't think that's impacting, though, the hospitalization rate for confirmed COVID-19 because, again, most people, as I highlight, most people who get infected with COVID-19 do not end up in the hospital. But a certain percentage will end up in the hospital, and those people tend to be quite ill. We don't admit them to the hospital unless they're quite ill and need things like continuous oxygen support or other interventions to keep them safe.
So you really kind of, Cassandra with K4 she asked about if you could clarify what Colonel Fry said at the governor's presser yesterday about hospitals liking to work at close to 100% capacity.
Well, I don't want to try to put words into Colonel Fry's mouth. I'll just say that any hospital, whether you're for-profit, not-for-profit, anywhere in the country, you have to maintain a margin to keep your doors open to pay your staff and salary. So what happened in March and early April was devastating to Oklahoma hospitals, with dramatic reductions by shutting down all elective procedures and reducing the number of people that came into the hospital. I think we saw tremendous financial consequences for hospitals that impacted employees and other things. So of course, if you're the leader of a hospital setting, you want to keep people in the hospital, or you want to be doing elective procedures in particular to help keep your hospital doors open, to keep your staff fully hired and those types of things. That's true of any hospital in the country.
And you did already kind of address this, but the question also from the same reporter was if you're concerned about the number of hospitalizations. So there's like a fine line. You want to have enough people that you can keep the doors open, but you can't have too many that you...
Yeah, so I'm going to argue that most hospital, I teach this in my public health courses, most hospital administrators would prefer to have the hospitals filled up with people who are having elective procedures, not people who are very ill. We're a trauma center, and so we still see a lot of patients that come in with stabbings and gunshot wounds and chainsaw accidents and motor vehicle accidents. That just happens in a trauma center. We have the NCI Cancer Center on campus, so we still have, sadly, a lot of cancer patients that do require hospitalization to provide treatment. We can't avoid those types of cases. Honestly, we really don't want to fill up our beds with COVID-19 patients. And it's part of my argument that we need to put a greater focus on the physical distancing, social distancing, the mitigation strategies, wearing masks in public, because if we don't, we could fill up the hospitals with COVID patients. So I just saw today that Florida hospitals now are having to shut down elective procedures again because their hospitals are so full of COVID patients that are filling up their ICUs. We just don't want to get there again. So I think, as I highlight, it's not an acceptable reason not to do more around mitigation because we have some hospital beds that are open. You don't want to get this illness and be in the hospital. It's profoundly, it has a profound impact on patients and their families, potential long-term consequences, and a small percentage, hopefully, but some patients will die when they get that sick.
I had a couple people asking about the new Hotspot Map, with the state's new, the color-coded alert system for COVID, I guess. There's one of the reporters is asking, why are some of the counties hotspots? In Tulsa and McCurtain County, she understood, but was wondering about places like McLean and Ottawa counties. Just maybe explaining why those might be hotspots, and then also, how does this map work? I mean, how does it help us to know where the hotspots are in Oklahoma?
So I can't talk to all of the question is about the hotspot map that was displayed in the governor's press conference. They've been talking about it, that would put different colors on the map to show you where there are outbreaks of the disease, which might provide some information to mayors and others that need to do more stringent interventions to prevent transmission of the disease. One thing that we had noted, we've been watching the county level maps for some time, and we noticed that there was almost an I-44 corridor through Oklahoma where you had people traveling through the higher density population areas of the state where we were seeing more infections actually happening and more community spread of the virus. So I would say that it may be helpful for identifying those target areas of the state where the percentage of the population who are testing positive, the number of confirmed cases is higher. There are different ways to make county maps. It depends on whether you're looking at the proportion of the population or the number of people per some like 100,000 population or 10,000 population, and that may be why there are differences in the map depending on which one you look at. You can go online and find lots of county level maps that are out there already.
Okay, Angelica at KOKH is asking about we talked about the concern in hospitalizations. Are we expecting another surge in cases following 4th of July?
Well, I don't know. What I think all of us are seeing right now is community-based spread of the virus. So if people on the 4th of July went out into public settings where they were around a lot of people and didn't wear a mask, then absolutely that's how the virus spreads from person to person. It's very contagious. And so you don't have to be around somebody very long without a mask to potentially breathe in respiratory droplets that could infect you. So I don't know what the potential impact is going to be of the 4th of July, but anytime you have people in crowded settings, particularly if they're not wearing masks, you increase the risk of transmission of the virus from person to person.
So, and that's kind of, and the next question was, what do you expect the rest of summer to look like? So.
Yeah, so one of the things, so the question is, what do I expect the rest of the summer to look like? I'm hoping in Oklahoma that as we see more and more mayors and others implement masking ordinances or masking orders, as people start to take this a bit more seriously and start to do a better job of physical distancing, wearing masks and other things, that we can start to control this outbreak right now that we're seeing in Oklahoma and slow it down. The one thing that I talked about early in the course of this particular disease, back when it first started, was, will this virus be seasonal like other coronaviruses? Will it go away in the summer like the flu? Sadly, we haven't seen that at all. And in fact, you look at very warm states, very warm and humid states like Florida, Texas, Alabama, Arizona, California, they're seeing enormous outbreaks of new cases right now. So there's no seasonality that we've seen with the virus to date. I think the other thing that I truly worry about, particularly with our neighbor immediately to the south with more than 10,000 new cases a day, we know a lot of people cross the border between Oklahoma and Texas a lot. And I think that makes it even more difficult for us to be able to control the outbreak in Oklahoma, because we know that people are going to be moving back and forth.
So she said, when do we expect that COVID will calm down in Oklahoma? Which,
yeah, so I was in a meeting earlier with some of my colleagues here that as we were talking about all the planning efforts around COVID, and I think all of us pretty much agree right now, until we have a vaccine that works, that can be broadly applied, we're going to be stuck with all of these mitigating interventions like wearing masks and physical distancing to slow the spread of the virus, because right now it seems to be spreading relatively unchecked through our population, particularly younger people, and in the absence of a vaccine, wearing a mask and other these public health interventions are about the only thing we can do to slow down transmission.
So she was asking about the fall, and then once flu season hits as well, I would imagine that these measures that we're doing to help for COVID will also help to maybe mitigate the spread of flu, right?
Yeah, absolutely. So the question is, what happens in the fall when we have both flu and COVID potentially? And so everybody's worried that that's the second surge or the second wave that everybody really worries about. Will we see really sharp increases in the number of cases in December, January, February, the typical months where you would see surges of the flu? And again, because this is a novel virus, we don't know what's going to happen. So we're going to be strongly encouraging everybody to get a flu shot this year, to at least try to prevent that one illness. The second thing is, you're absolutely right that wearing a mask, if you look at most of the research that's been done in the past looking at the use of masks or face shields, other things to prevent spread of respiratory viruses, most of it was done for influenza. So the things that we're doing now, wearing masks, maintaining physical distancing, hand hygiene, should help us slow down the spread of influenza this year also.
I'm going to jump over to Phil at Fox, was asking about the swine flu and if you knew anything about that. So, and is that something on top of this, or does something come out later?
Yeah, so some people may have heard that Chinese officials have announced that there's a new virus. I think they call it the G4 virus in China, but it's very similar to the H1N1 virus or the swine flu that hit the United States a number of years ago. So far, China has not reported human infection with that particular virus, but it was just one more thing to make us have some anxiety. Could there be another virus that causes another pandemic coming our way down the road? So don't know much more about it at this point.
Okay, so Yasmin with K-Toll, she's in Tulsa, she's asking about how the governor doesn't want to mandate masks for the state, but and doesn't want to be where we are shaming people for not wearing one, but is this sending mixed signals about wearing one? What do you say to people who are not already wearing one in public?
Well, I think not only they're putting their own health at risk, but they're putting the health of the people around them at risk. And again, the way I explain this is just a couple of facts that we know now. 40 or 45% of the people who get infected with this virus will not have symptoms or have minimal symptoms, will never seek medical care, and don't get a test done. You don't know whether you are one of those people or not. So if you're not wearing a mask, but you're around your neighbor who has diabetes, or somebody that's had cancer, or has a kid that's sick with some immunosuppressive disease, you could spread the disease to them and not even know it. And so wearing a mask is a thing of courtesy to protect those people around you. It also probably affords you a little bit of benefit, because if there are respiratory droplets in the air, it reduces the chance that you may inhale those. So we wear the mask in part to protect ourselves, but primarily to protect those around us. there is no other intervention at this point. So I actually strongly agree that we should mandate masks at this point, because we're seeing such unmitigated spread of the virus in our population in Oklahoma right now. And then if we see things change down the road, then potentially that can change down the road. It is not a violation of your constitutional rights or your civil liberties. Public health laws have allowed interventions to prevent the spread of disease for centuries.
Cassandra Sweetman asked another question. Is there any updated information on whether people can be infected more than once? Can people who have gotten the virus and recovered feel safe? Can they get sick again? If not, can they still spread the virus?
So the short answer is we don't know whether you could get infected again. There's growing consensus that if you had a positive PCR test, you had COVID-19, you probably do have some period of immunity to getting reinfected with this particular virus. And although there have been some mild mutations with the virus, most of them have not impacted the actual spread of the disease at this point. In terms of making it more severe or not susceptible to things like antibodies or vaccines. That said, we don't know how long that immunity may last. And so the kind of the consensus at the moment is that if you've been infected, you'll probably have some period of immunity, but how long it lasts, we just don't know yet.
Those are all the questions that have come in. Is there anything new that, I know a few days ago I heard something that they were saying that it had mutated, that it was becoming more aggressive or something. Are there any, what's the latest?
Yeah, so there does appear to be a mutation of the virus that affects primarily the spike protein. That's those spikes that you see that come outside of the edge of the virus. Those are what attach to human cells. And so the mutation seems to have made the virus more contagious. How did it do that? It replicates more. So if I get infected, I'll have more of it in my nose, nasopharynx, and mouth. And so if I'm speaking, chewing, coughing, singing, doing anything, more virus comes out, which makes it more contagious. The good news is that it doesn't appear to be any more severe than the previous virus. However, there's no evidence that it's any less severe, so it spreads easier.
So I know that because when you're talking, sometimes the mask slips a little, but this is probably a really good example of why you also wash your hands. So maybe you just...
Yeah, so I've had to touch my mask several times only because, and I wear one all the time here at the university, but this speaking has made it slide a lot. So yes, we recommend that you do, particularly if you have to touch your mask. If I'm doing patient care, I'm absolutely, before or after anything I do with patient care, doing hand hygiene constantly, multiple times within a single patient encounter. But it's part of the reason we do recommend hand hygiene, because if there happened to be virus somewhere, then I touched it and touched my eyes, nose, or mouth, I could potentially spread the virus.
Because I've seen some people say, well, if you can't be socially distanced, wear a mask. If you can't wash your hands all the time, wear a mask. But it's all those things. It's not just one or the other. You need to remember all these things.
Yeah, I will highlight that in the research that's been published, the two most important interventions that seem to be the most effective are wearing a mask and physical distancing. The farther you're away from somebody, the less likely you are to inhale their respiratory droplets, and wearing a mask. And here's the good news. A simple cloth mask that the ladies at the church make for you is actually very effective at preventing droplets from coming out of your mouth. I heard a news story this past week that was talking about how safe are surgical type mask versus cloth mask. And yes, if you're on the receiving end, we don't let our healthcare workers, our nurses, doctors that are taking care of sick patients, we don't let them wear a cloth mask because they're not as efficient at filtering out stuff that comes in. However, a cloth mask, a simple cloth mask, there was a wonderful study done at Florida Atlantic University. You can Google it. It's a fascinating study that shows that a simple cloth mask is very effective at stopping droplets from coming out of your mouth, and they don't go very far at all. In fact, so effective, sometimes even more effective than some of the other masks that we wear.
That's great. Anything you want to add?
Those are the key points.